Well, hello, health coaches. Erin Power here with you. I've got a great one today as we button up the end of another year. I've been health coach radioing with you for 6 years, coming up on our 7th year of the podcast. And that's fun for me because I've been in the health coaching industry I've been as a health coach for 12 years, but I've been an educator for about 8. And why I'm excited about this generally, about today's topic, which I'll get to in a second, is because, man, this industry is growing and changing. And I just want you to be along for the ride. So let's buckle in for the future of health coaching. We're talking about trends, we're talking about challenges, and we're talking about opportunities. So this, my friends, is a forward-looking conversation.
Hi, I'm Erin Power. I'm a health coach, a health coaching educator and mentor, and your host of Health Coach Radio. This podcast delves into the art, science, and business of health coaching. Whether you're aspiring to land a coaching dream job or to embark on your own entrepreneurial adventure, we cover it all. Our mission is to help you grow your career, elevate your income, change the lives of the clients who need your help, and leave a lasting mark in this rapidly growing field. It's time for health coaches to make an impact. It's time for Health Coach Radio.
If you're in practice as a health coach, I know what it's like. You know what it's like. You're pretty focused on the here and now. You're trying to help people make an impact, make an income, get your business set up. There's a lot of moving parts to being a health coach. And so a forward-looking conversation, I think, can give us some optimism, some excitement. What I like about these kinds of conversations is it speaks to the growth of an industry, the industry that we're all in. For many of us, it's a brand new industry, and it's fun to see it really get a foothold. Now, this topic's important because the health coaching industry is evolving and changing. And, for us, staying ahead of trends and having a clear picture of what's going on, that can help position us as leaders in the space. This is for you. This is for you, health coaches, so you know what's going on. So we're going to talk through some of the trends in health coaching, some of the challenges in health coaching, and then the opportunities. All right, I'm ready to dive in. Are you guys ready to dive in? Let's do this. So trends in health coaching, let's start here. Number one trend that I'm seeing is integration into healthcare systems. There's a growing demand for health coaches in clinical settings. So we're talking in healthcare, we're talking primary care, functional medicine practices, integrative medical clinics, telemedicine, sort of collaborative units where the health coach is an integral part of the healthcare team. Now, I have some friends and peers who are doctors, doctors, naturopathic doctors, functional medicine doctors, MDs, everything, running the gamut. And they are pulling out of their brick and mortar practices. They're pulling out of the conventional model because they're kind of frustrated by the conventional model. Doctors are, because the conventional model is pretty frustrating, isn't it? So they're pulling out, they're starting their own online sort of concierge practices. And these doctors are hiring health coaches. I love having these conversations with doctors. They're saying, hey, I want to hire a health coach. Where can I find one? How much should I pay one? What can I get them to do? What aren't they allowed to do? A lot of times the doctors know they need a health coach, but they don't know why or what a health coach can do. So if you know why and what a health coach can do, that positions you as somebody who can step into one of these clinical practices and really take that bull by the horns. This is a growing trend in healthcare. Collaborations between health coaches and licensed medical professionals, which we are not. Health coaches not licensed, not regulated. I actually love that for us. We don't need to be. We help clients and patients execute behavior changes that are very generally simple and not easy though. Simple but not easy. So we're unlicensed, but licensed medical professionals who are frankly too busy to be in the weeds of health change with their clients need us. That's one of the most growing trends for health coaches coming up in 2025 and beyond. Another trend I'm seeing a lot of is advancements in tech. We're talking telehealth. We're talking virtual coaching platforms. We're talking, health and wellness organizations that are using technology to reach their clients, their customers, and want a coach somewhere in the back end to facilitate these client coaching conversations. And there are AI-powered tools. We've got chatbots that are working as health coaches, but the in-person, real, live, breathing, sentient health coach is still the power player in this. You already know. You've dabbled in the AI space. It's not that great yet. Humans need humans. I feel this so strenuously. I know we're worried about AI. Hey, you know what? It's here to stay. It's not going anywhere. So let's learn to coexist with it. Do you know what I mean? At the end of the day, humans need humans. The human-to-human connection of health coaching is one of the most powerful parts of the health coaching relationship. Now, AI is useful in these tech platforms for personalized client plans like symptom trackers, food journaling apps, maybe collecting biometric data from wellness gadgets. Some of these wellness apps and technology, they bring in lab testing results. So it becomes this dashboard that the health consumer can use. And within that dashboard is access to a human. And that's you, the health coach. Number third trend that is emerging, according to some of the research and data and reading I've been doing, is actually, and this is exciting, so get excited, a focus on preventative health. Okay. From a health coaching business perspective, I have said this. You may have heard other health coaches and business coaches say this to you, but quite frankly, it seems as though prevention doesn't quote unquote sell. So going to market as a health coach who works in preventing heart attacks, preventing diabetes, preventing obesity, it's just not an urgent problem for whatever reason, for better or worse. Human beings just don't seem to be that concerned with delaying the onset of things that aren't necessarily present in their lives yet. We are more concerned humans by the thing that is present in our life. So for that reason, the thing that is present, the thing we're dealing with now, the thing keeping us awake at night right now is generally where you want to position yourself as a health coach. But what's coming up as an emerging trend, which is exciting, is preventative health. The health consumer is now realizing, wait, I need to get ahead. I need to get ahead of my health degradation. And I'll tell you something, I've seen this in my own health coaching practice. I have seen more and more clients come in, and maybe this is because I'm aging, and so my clientele is aging, but they're saying things to me like, yes, I want to feel better. Yes, I want to get in control of my health. And also, I'm watching my parents and my aunts and my uncles and my siblings, my older siblings, go through their later stages of life, and they're falling apart. And I really don't want that for me. So it actually seems as though, and this is great news, the preventative health narrative is actually picking up steam. This is awesome for health coaches. We shine here. Health coaching is a key player in reducing chronic disease rates because most of the sort of modern chronic diseases are a consequence of, diet and lifestyle inputs, which we have a handle on. We have a hand in helping our clients make moves on, right? Taking walks, going to bed, eating more supportive whole foods, eating less processed foods, understanding how to take care of oneself. So this is right in our wheelhouse. And, alongside this trend is an increased emphasis on lifestyle medicine and behavioral health. So like the health consumer, which I call them the health consumer, that's the people who are going to inevitably be our clients, whether we work in private practice or go work in a medical clinic, the people we work with, that's the health consumer. They're seeking out lifestyle medicine. They're seeking out behavior change. There's change afoot. And I think it's exciting and possibly an opportunity for us coming up here. Here's another trend, niche specialization. Okay, so hopefully you've already been zeroing in on a niche, but niche specialization will just always continue to grow. It's not going away. So we put it on the trend list for 2025. So This is, perimenopause weight loss, or helping men naturally boost their testosterone, or get rid of the dad bod, or, increase your performance in the gym, or if you're, get better times at your endurance events, or, perform better on the tennis court. Like, we are getting super specific. The more specific, the better. Other industries do this really well, by the way. I was thinking of some other peers of mine that are in the coaching space, not necessarily health coaching per se, but coaching. For example, I know a gal who is a specialist in helping train or coach parents to potty train their toddlers. Now that's niche. But hey, if you're a parent with a toddler trying to potty train it, you're like, take my money, teach me how to do this. So anyway, niche specialization has always been a thing. It's not a new thing. I'm just putting it on the list for 2025 because it's still a thing. There's a growing and consistent consumer demand for tailored approaches rather than generalized help. And you already know that because you're a consumer. And as a consumer, you seek out tailored, specialized help, right? If you need to get your drain unplugged, you're not calling a general contractor. You're like, plumbers near me, right? You already know. That's how you shop. That's how I shop. That's how we shop for services. I have blonde hair. When I'm looking to get my hair colored, I'm looking for blonde experts. You already know. So just me reminding you that your tailored approach, the niche specialization, continues to be a booming industry trend. So what's yours? What is your expertise? What is it? What do you do? What are you a world-leading expert at? Oh, just called you out. I just called you a world-leading expert. How do you feel about that? Did the imposter syndrome kick in? That's okay. Just sit with it for a minute. But don't be shy about declaring yourself a world-leading expert because clients want to work with a world-leading expert. So if it's not you, it's going to be somebody else, okay? Just putting that out there, a little pep talk. Well, let's be well-rounded about this conversation on the future of health coaching and talk about challenges facing health coaches. So we are always, number one, slightly besieged, shall we say, or at least we should be hyper-aware of the regulatory and scope of practice limitations of health coaches. So I contemplate this to actually be one of the blessings of health coaching, which is that we are unregulated. I mentioned that earlier. I like being unregulated. I like it. I'm not in a hurry to get regulated because as soon as I'm regulated and you're regulated, things change for us. Here's an example, just an anecdote. Recently, I had a client call me. Now, if you don't know, I live in Canada. So I had a client come through for a consultation. She wanted to lose weight, which is what I do. And she said, I'm trying to decide between you and a dietitian. And I said, oh, that's interesting. I'm curious why we're the two that made the short list. And she said, well, you're on my short list because I really like your approach and you seem like you have a solution to my problem. Ding, ding, ding. The dietitian is on my short list because my insurance covers it. So, darn. And wouldn't you know, she went with the dietitian because it was going to be free. She didn't have to pay for it. Now, I don't love that for her. I don't want her to pick the cheapest option. I want her to pick the best. That's me. That's you. That's us. Dietitians are regulated. Well, all respected dietitians. I mean, we need them. We need dietitians. Oh my gosh, we do. They're a regulated profession and we're not. So sometimes in those situations, a health consumer might say, well, I'm going to go with a dietitian because they're covered by my insurance or my doctor recommended it, or here in Canada, they can be free, right? So we're up against that. We're up against the limitations of being unregulated. And I just want you to know there's also some upside to being unregulated. We're not as beholden, shall we say, to the conventional wisdom around health and wellness topics. We don't have to prescribe food groups and all foods fit. And we have a lot of leeway as long as we're well behaved. Something you should know about me as a health coach educator is that in the school that I'm on the faculty of, Primal Health Coach Institute, we are staunch advocates for health coaching scope of practice. We do not waver. We do not test the limits of the loopholes of our scope of practice. Health coaches, I beg of you, don't do that. Don't do that. We just need to stay in our lane. We can help a lot of people, but we don't want to push the boundaries of scope of practice of professional conduct, because then we're going to get noticed by regulators. And that's going to take away a lot of our freedoms and rights to do what we want to do. So our unregulated status has its ups and downs. It has its pros and cons. The cons are people who are seeking regulated health professionals are going to think, I'm not going to work with a health coach. I'm going to work with a doctor or dietitian or what have you. That's okay. That probably wasn't your ideal client anyway. Your ideal client is somebody who has maybe been in the regulated sort of medical system and hasn't had success and is now looking to take it out of the conventional realm and take matters into their own hands. One thing I would encourage you to do if you're a health coach is just really understand your scope of practice. One of our favorite resources is the Council of Holistic Health Educators. I think they're called the Holistic Council now, holisticcouncil.org. Really good group of people, first of all, that aggregate scope of practice information regionally, so that predominantly this is in the United States. But it gives you a good sense of generally what scope of practice regulations are for health coaches. The other thing the Holistic Council is doing is they're actually advocating for us. They're seeking out legislation that might be on the verge of changing, and they're showing up to the lobbying sessions and going to bat with legislators to try to get some wiggle room and get us in the room. So great group of people to help you understand your scope of practice and also to help us all, fight for our rights to help people.
It's an exciting time to be a health coach. Scientists are uncovering the mysteries of the human microbiome. We're now gaining clarity into complex gut health issues we didn't even know about a decade ago. This means it's also a great time to become a gut health expert. Primal Health Coach Institute's Human Intestinal Microbiome in Health and Disease Specialist certification is for health coaches who want to help people heal the root problems of many of their health symptoms and conditions. A recent survey spanning 73,000 people across 33 countries found that nearly 40% of adults suffer from a gastrointestinal disorder. As an expert in gut health, you can offer unique programs and services to clients looking to manage or reverse a diagnosis such as an autoimmune disease, irritable bowel syndrome, or type 2 diabetes, or those who wish to improve their overall health. Gut health expert, cardiologist, and best-selling author Dr. William Davis teaches you everything you need to know about the human microbiome, including coaching tips to give you the confidence and credibility to support your clients and help them heal their guts, sleep better, gain more energy, and enjoy stronger immunity, balanced mood, smoother skin, and more. Find out more about how to become a gut health expert. Visit primalhealthcoach.com.
All right, another challenge facing health coaches would be technology overload. Interesting because it's an opportunity. I mentioned it a minute ago, but it's also possibly a struggle. So it's like, how do we balance the use of tech tools with the fact that we're humans? We're humans. Again, I go back to what I said a minute ago. The human-to-human connection, shoulder to shoulder with your client. That's what they want and need. At the end of the day, we are still humans. We're not cyborgs yet. And we have access to amazing technology. Some of it's good, some of it's bad. So what our opportunity is here is to figure out how to coexist with the technology. So how can you bring some technology into your business? I've said this to a lot of our students that I think we do need to accept and embrace technology to a certain extent. It's, again, not going anywhere. It's 2025. It's the future. Computers are here to stay. The AI robots are here to stay. We have gadgets. We have technology resources. Clients are using them already. Can we coexist? So that's my encouragement to you. Learn new platforms. Stay updated on digital trends. And try to do this without burnout. And that's a very real concern. I think that's why I put this on the list of challenges, right? It can feel very overwhelming to try to stay updated on technology, which is ever changing. So all I'm asking is just Dip your toe into it. Be open to it. Don't be closed off to it. Because if you are closed off to technology, you might be left behind. I don't want that for you. One more challenge. Oh, I know you're going to know this one. I know you're feeling this one. You're waiting for me to say it. Competition in a growing field. There are more health coaches entering the market. And it probably feels like in some corner of your mind that it feels hard to stand out in a crowded industry. Well, listen, I want to validate that. And I also want to remind you that there are plenty of unwell people to go around. All you need is 10 clients this year, 15, 20 clients this year to have a good year. 30 clients, 50 clients. 50 clients is usually my goal. And I hit that goal the last 3 or 4 years. 4 years, I think I hit that goal. 50 clients or more. 50 people. There's hundreds of millions of people that need my help. And I got 50 and I had a good year. That's all you need. You don't need all the clients. You can't help them all anyway. So don't stress about that. I know you hear this pep talk a lot, but it's just actually objectively true. You need 1 client, 10 clients, 25 clients, 50 clients to have a good year. I say 1, by the way, the reason why I put 1 on the list, you're like, 1 client. Well, you need 1 to start. Just worry about getting the first one. If you haven't even had a client yet, the last thing you need to be worrying about is how saturated the market is. Get 1 client. Get your second client, get your third client. Eventually you get up to 50 clients and you'll see, wow, there are way more people here than I can possibly help. I'm good. Does this make it harder for you to stand out in terms of your branding and your positioning? Possibly. A lot of noise, right? I call the telephone here the old rectangle of doom. We're on it all the time. That's where people are shopping now. Case in point, I'm in the weight loss industry. Well, how many weight loss products, programs, coaches do you think my average ideal consumer bumps into during a casual afternoon scroll? Probably 100. I'm one of them. So I just need to stand out. Well, how do I do that? Well, here's how I do it. This is just a quick little marketing, hit for you. I just firmly plant my flag in the ground and I say one thing. I have one point of view. I do one thing. I don't jump around and do sleep and longevity and optimizing perform. I don't even know. Optimizing, by the way, this is just a parenthetical. Optimizing, I think you need to delete that from your marketing vernacular. It doesn't mean anything to the consumer, the average consumer. So this is where we go back to narrowing your focus and really targeting your niche. What's the one thing you're the world leading expert in? And then just repeat it and repeat it and repeat it. So there's no ambiguity. People who find you and follow you will say, this person does that one thing. And that's what I either need or don't need. You're making it easy on the consumer because it's hard for the consumer. Let's make it easy for them. I want to say one more thing though about a growing market. Quite frankly, I only want to be in industries that are growing. I don't want to be in an industry that's dead. If it's not a competitive market, if it's not quote unquote saturated, I don't want to be in it. I don't want to be in some random niche dead market that nobody's paying attention to. What's the point? Being the only person in a non-flourishing market. A saturated market is a good sign. Listen, if health coaching has become a saturated market, which it has not, it is not saturated, but it's getting busier, what does that tell you? It's because people need health coaches and consumers are seeking out health coaches and the opportunities abound. I always think about this. This is my analogy that I use often. I was driving around and I noticed a brand new dental clinic had opened up. Brand new, now accepting patients. So some dentist just came out of dentistry school, found a building, opened a clinic, hired a bunch of hygienists and a receptionist and whatever else you need in a dental clinic, and just went to business. He's like, all right, let's go. You got teeth? I'm a dentist. Come on in. And he's not worried about a saturated market. There's a dentist down the street. There's a million dentists in, everywhere, right? But people have teeth. People need a dentist. When this person went to dentistry school, I don't know how long it takes to become a dentist, but I'm assuming it takes a long time and you have to get a pretty expensive degree. And nothing stopped this person from doing all that work and then putting in the effort to open a dentistry clinic, knowing there's a dentist just down the road, just around the corner, there's another dentist. I don't hear dentists worrying about a saturated market. I don't hear hairstylists worrying about a saturated market. In fact, most hairstylists I know, the good ones, are booked. They're not accepting new clients. That could be you. It's a busy industry. That's a good thing. Let's go. Reframe. Let's talk about opportunities for health coaches. I have a lot. I have a huge list, and I'm just going to give you a few. Okay. Number one, expanding roles in chronic disease management. So I touched on this earlier. Health coaches are helping to bridge the gap between patients and healthcare providers, specifically in the realm of chronic disease management. What are we talking about? We're talking about type 2 diabetes. We're talking about, metabolic syndrome, which includes like high blood pressure, heart disease, the number one killer, unfortunately, not to get morbid, of Americans, humans on the planet. Chronic disease management. Chronic disease doesn't appear to be getting any better. It's probably getting worse. That's not great. We're not happy about that, but we can help. So we help healthcare providers, the licensed ones, bridge the gap between the busy provider and the bewildered patient. The provider says, hey, your blood pressure is too high. Deal with that. Eat right and exercise. Okay, I got to go. The patient's scared now. Oh no, I have high blood pressure. What does that mean? That's where you come in. Hey, patient. Hey, Bob. The doctor just told you have high blood pressure. Do you know what that means? Bob's going to say, no. Am I going to die? Okay, Bob, let me if you're cool with it, I'll just teach you a little bit about blood pressure. What did the doctor say about managing your blood pressure? Well, he said I have to eat right and exercise. Okay, let's talk about that. You can help Bob do that. We help address behavior change, which is the overlooked component in medical care, right? That's our job. How exciting. How lucky are we to help people? Wow. Number two, opportunity, partnering with employers for workplace wellness. Now, this is an area that a lot of health coaches are very excited about. A lot of health coaches want to specialize in corporate or workplace wellness. I think it's a bit of a hard market still to get into, but just like any sub-market of the health coaching broader market, it's growing. I think you'd be doing a little bit of pounding of the pavement to find organizations that are looking to bring a health coach in, maybe fractionally on a contract basis, to introduce programs to help people, maybe manage stress or start a walking program or a weight loss challenge. There's lots of ways you can do it. If it's something that's really, really important and feels exciting for you, then, you have to put together a pitch deck to pitch yourself to HR managers and like the executives in charge of people and culture, right, at the companies, to make sure that they're even looking for that kind of help. And then how can you position yourself to get in there? So something really always on the agenda as an opportunity for the very enterprising, shall we say, health coach that wants to get out there and get back into that office environment and help office workers get healthy. And we all know, I know because I had a 20-year corporate career before I left it all to become a health coach. And people at offices are pretty unhealthy. They sit around a lot. They're kind of trapped indoors a lot. They're under a lot of pressure. There's a lot of burnout. And we can help. I think an opportunity that's coming up is, I call this emerging niches. So when you're contemplating a niche to get into, like, explore underserved populations. So midlife health is a big one. Okay, we've got the Gen X and millennial generations coming into midlife. And what I think is exciting about this is that we're solutions-oriented generations. I'm a Gen Xer, so we are solutions-oriented populations, unlike maybe our boomer parents, the boomers that preceded us, who just kind of maybe were more accepting of their degrading health and accepting of what the doctor said. Oh, the doctor said I have high blood pressure. I'm on this medication. Such is life. Boomers and Gen X and millennials aren't quite putting up with that. They're looking more for solutions. So, hey, midlife health. If that's you and you know how to help, your midlife Gen X or millennial peers get and stay healthy, zero in on that. Zero in on it. There's always pre and postnatal. I think there's an emerging trend with respect to like fertility. Fertility seems to be a growing concern for women. If you have some kind of fertility knowledge, if you yourself, improved your own fertility through health improvement, like that could be amazing. We had a student in our school who specializes in the Amish. That's incredible. You could develop expertise in like cutting edge areas. So things like circadian biology or biohacking or, mental health optimization. There's that word I don't like. Now, what I will say about this, I just want to put this out there. When I wanted to include these types of sub niches in this list because I know that's exciting to a lot of health coaches. Let's say, for example, here's an example that comes up a lot. Let's say you want to be a carnivore coach. Okay, the carnivore diet, right? You went on a carnivore diet and it solved your struggles. So now you want to be a carnivore coach. I'm Susie, the carnivore coach. Well, putting yourself out there as a carnivore coach or a biohacker or a circadian biology coach means you're going to be attracting clients who know that that's what they want. Like if I'm the client and I'm like, I want to go carnivore, I need a coach to help me go carnivore, then I will search a carnivore coach. But just know that you're really, really narrowing the playing field a little bit. What you could do and what I think you should do is, I think it's still wise to speak to like the lived experience of the client. So for example, let's say you went carnivore because you had some kind of an autoimmune disease. I don't know which one, just pick one. You had an autoimmune condition, you went carnivore and it seemed to resolve your symptoms or at least put them into remission and you're excited about that. Cool. So maybe you become a health coach that focuses on those autoimmune symptoms and maybe you use a carnivore diet approach or something plant-based. You can do whatever you want, quite honestly. But my encouragement to you would be, if you are going to go into a very narrow niche, you still want to speak to it from the perspective of what clients are looking for. Okay. Now, if you want to be a biohacker, we get this a lot. We want to be a biohacking coach. Well, then you are attracting a biohacking crowd. You're attracting somebody who's already a super health nerd and they just want to level up their nerdiness alongside you. So that's a really specific niche, but I think we need those. I mean, I go back to what I said earlier. The more specific your niche is, the better. Sometimes we can go a little too specific though. Just think about what people are searching for, but have fun with it. There's opportunities. This is kind of a fringe idea, but one of the opportunities that came up for me was this idea of like advocacy and leadership. So I was referring to the holistic council earlier. That's an advocacy group that's advocating for health coaching and health coaches, and they're going to legislators and they're having conversations, at hearings and things, right? At their local government level. Interesting, right? It could be something that maybe if you have some advocacy background, you could blend your backgrounds. In fact, blending your background with whatever you did before, if you had a previous career as a health coach, really good idea. Bring in what you already know. Were you a teacher? I was an advertising executive, whatever you were. What do you bring from your past life that you can fold into your health coaching practice? I mean, I think about health coaches that, had a health coaching business of their own. Their business grew so much that other health coaches came to them and said, hey, how did you grow your business? And now those health coaches are business coaches, right? Same idea. You could become a health coaching advocacy coach, right? There's lots of ways to become a thought leader in wellness communities. I work at a school, for example. I'm a health coaching educator. So I'm a health coach and I get to teach other health coaches how to be a health coach. There's soon to be opportunities with like insurance companies. As we get closer and closer to maybe someday health coaching being a reimbursable thing through insurance policies, well, potentially insurance companies are going to need some kind of health coaching expert on staff to help them understand this model. So something to contemplate. I think there's another niche, a sub niche that came to mind that I just think is worth mentioning. I want to know from you folks. So, as you listen to this episode, if anything comes to mind or you want to ask more questions, please make sure to reach out to me at hello@primalhealthcoach.com. And by the way, if you're a practicing health coach and you have an interesting story to tell, I would love to talk to you on the podcast. That's my favorite, talking to health coaches. But I was thinking about a few more like sub niches. And one that came to mind is like mental health and emotional resilience. So using lifestyle interventions to support mental well-being, reduce anxiety, promoting emotional resilience. I think this is emerging because there's just rising mental health challenges. And there's a desire for holistic approaches that go maybe beyond therapy or medication or work adjacently, right? So adjacent to medication and therapy, right? I think that's a big one. For us, it's sort of like we're not out here trying to, this is a personal crusade, but we know that stress is unhealthy. Chronic stress is not great. A lot of downstream poor health effects from unchecked chronic stress. Something I tell my clients all the time is, hey, your life is stressful. It is. Modern human life just is stressful. And that's, in some cases, there's an inevitability to that. However, is there some aspect of your sources of stress that you can claw back a little power from, right? So maybe you have a really unique approach to helping people carve out time for themselves, have quiet moments. Maybe you're really good at like phone addiction. Oh my gosh, a phone addiction coach. Oh, talk about a niche. Ooh, I like that one. You guys should take that one. Somebody should be a phone addiction coach. I can think of all kinds of ways you could be a phone addiction coach. I mean, there's tools you could, I saw this tool called a brick. It's a physical little device where when you tap your phone on it, it locks all the distracting apps off your phone. You can't access them until you tap the brick again. Imagine if you're a phone addiction health coach and you have the brick. You hold on to your clients' bricks and you tell them, I don't know, it's a bit extreme, but we might need that kind of extreme approach. Phone addiction is becoming a real problem. I'm thinking in terms of like sub niches, very focused, like performance and recovery coaching. So maybe this is supporting athletes and fitness enthusiasts with recovery protocols, injury prevention, performance optimization. I do see a lot of physical therapists doing this. It's pretty cool. Like physical therapists that maybe were working in clinic for a long time are now coming out of clinic and creating online programs for like tennis elbow or, knee pain for runners. Like, I just think there's so many neat, imagine if you were the tennis elbow person. Have you ever had tennis elbow? Oh my gosh, you'll do anything to get rid of it. It's the worst. If I had found a tennis elbow specialist when I was battling tennis elbow, I would have paid them. Like, get rid of this. It's brutal. So I think that's pretty cool. You know what else I was really getting excited about when I was at the gym today? Young people, it seems, maybe I'm just focused on women because I'm a woman, but young people are really embracing fitness and lifting, right? They're lifting. They're in the weight room. Nobody's hitting fitness classes anymore. No one's in the spin room. They're in the weight room. This is very cool. So just think about all these people lifting and trying to get stronger and how they will need recovery protocols to make sure they don't break their bodies down. I think this is emerging because there seems to be, at least in some circles, a greater emphasis on getting stronger and maintaining good performance and assuming that these up and coming fitness, peeps have a well-rounded holistic approach to their bodies. They're not just in there grinding. They're working hard and they're recovering hard. Well, we need recovery coaches. That could be really amazing. What about like adolescent and teen health coaching, guiding young people through nutrition and emotional resilience and healthy habits? I don't know. That could be something. We know there's rising rates of childhood obesity and anxiety and early signs of metabolic dysfunction. Wasn't one of the weight loss medications just approved for like 6-year-olds? It's getting a little weird. Now, what I will say with working with kids is sometimes their stage of change, if you know the stages of change, they're not quite at the readiness stage of change. Kids aren't necessarily thinking about their health because they have that resiliency on their side, but their parents might be. I had an acquaintance whose son needed to go on one of the GLP-1 medications. He was very overweight and he wasn't taking care of himself. And she set him up with me to talk about food. He's going to work with the doctor on the medication dosing, but he also needs to eat. And that's where he came to me. And then she set him up with a personal trainer to get him moving well. So, you could zero in on the parents of adolescents or teens that need help. So speaking of GLP-1s, I actually think that's a niche as well. Okay, don't come at me, but they're not going anywhere either. Not for a while anyway. We don't know. We don't know what's going to happen, but they're here now. They seem to be pretty easy to get. And people have high hopes for them. But what we know is that, well, I don't know if we do know this, but what we're kind of hearing is that the way the medications work, it makes it really hard to it can make it hard to eat right. And it can make it seem like, oh, easy weight loss. I'm just going to take this injection or this. They have them in pill form now, and that's going to do the work for me and I don't have to do anything. Well, we know that that's not a long-term solution. So health coaches who are open to GLP-1 medications could find themselves with a big audience. Just putting that out there. Now, flip side. If that really grossed you out to even consider it, I want to just validate that. Flip side, substance-free weight loss. You can be a proudly anti-GLP-1 weight loss provider. You can say, don't take an untested medication. They're tested. They're honestly tested. We have to watch our language because I just think sometimes health coaches can get a little worried maybe about medications and pharmacy, but you can say this. You can say, before you jump to medications, come work with me. I can help you lose weight without medications. So there is, just as there's rising interest in the weight loss medications, there's also rising skepticism. So you could pull either one of those levers. I had one more. Cultural and community-centered coaching. So I talked about the coach who focuses on the Amish. We've had coaches who focus on certain indigenous cultures. So this caters to specific cultural or community needs and traditional dietary practices and values like fasting or very, grain-based or whatever types of diets different cultures and communities adhere to. And, it could be really interesting, especially if you yourself obviously have exposure to a certain culture. You leverage that, right? I think it's actually crucial to acknowledge. I think it's important to pay attention to the cultural relevance when helping people achieve sustainable health outcomes. I think about a client I had she was from Pakistan, and just as part of her diet, she consumed a lot of rice. And it's like, I couldn't tell her to stop consuming rice. That was her cultural diet. So we had to work with that, right? Maybe I'm not the right person to work with somebody who has that kind of cultural diet. I don't know it. Maybe that's not my wheelhouse. Maybe that's somebody else's wheelhouse. I think that's pretty cool. These niches all matter. There are a lot of them. You could think of a million. I think I gave you a few good ideas. Take those ideas and use them as sort of a launch pad to think of other ideas. I just think the opportunities are pretty endless for us as long as you're pretty open-minded. Growth-oriented, which I think is a really crucial health coaching life skill. But hey, 2025 is upon us pretty soon here, and health coaching is just growing. It's just growing, so hang on for the ride, come along for the ride, and you'll be surprised at where you can be this time next year. And I can't wait to connect with you again. All right, but for now, there's some trends, some challenges, some opportunities we're seeing in the health coaching industry. Very timely content as we wrap up another year. I will see you very soon for another episode, but I hope that was helpful. All right, take care, health coaches.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.